All right. Hi, everyone. My name is Kate. Thank you so much for joining us today. I'm so excited for this webinar because we're going to chat today about low vision, and the timing is great. We just had Low Vision Month back in February, and so this is a really important conversation. So I'll go ahead and just introduce myself. So I am Head of Business Development at Marketing for ECPs. If you are not familiar, we are a full-service digital marketing agency, and we specialize in everything from website development to social media to email marketing to Google Ads. Really, we do everything. And it's really about just driving patients to your practice and having people know who you are. And I'm really excited to introduce my co-host today, Dr. George Papadakis. George, I'll actually hand it over to you to go ahead and introduce yourself.
Thanks, Kate. George Papadakis, practicing optometrist for over 30 years with a sort of interest in low vision and helping patients who are visually impaired with diagnostic treatment and sort of planning their rehabilitation.
And yeah, like I mentioned, that is what our webinar is about today. We're going to chat all about low vision. So we're going to go through a little bit of an introduction first, chat about what low vision actually is. We'll talk about the diagnosis, treatment, and therapy, and then have a conversation around the future of low vision. So let's jump right into it and get started on what actually is low vision.
Okay, so low vision is usually misunderstood. The term refers to patients who have a visual impairment that generally cannot be corrected with traditional methods like glasses, contact lenses, medication, or even surgery. So unlike total blindness, these individuals have some form of usable vision that we can work with.
Right. And can you explain what are some of the common causes of low vision and who would be at most risk?
Yeah, so as number one cause is unfortunately aging that can lead to certain age-related visual impairments such as macular degeneration, glaucoma, cataracts can lead to low vision, and sometimes they're not operable. And then there's congenital conditions that you're kind of born with that, or injuries that can cause a reduction in vision.
Right, of course. And what point does someone actually qualify as having low vision, and how is that diagnosed?
So a lot of people think that you have to be legally blind to have low vision. Well, somebody who has even 20/70, and in some cases even 20/50 visual acuity, has a lot of our demands these days are vision, a lot of reading, detailed work. So even with 20/50 or 20/70 vision, which is basically somebody not being able to see print unless it's around 2 or 3 times larger than sort of 20/20 print, that would be considered low vision.
Do you feel like low vision is increasing right now? Like you're seeing more of that?
Yes, fortunately, we're all aging, we're living longer. Um, Again, also demands are changing. So diabetes can cause low vision, and the incidence of diabetes is drastically increasing, and a lot even in younger populations. So yes, unfortunately, we are seeing more, but at the same time, we have better methods that we can reduce the effects of visual impairments, not allowing somebody to get as advanced as it used to get, or as certain conditions used to get.
Right, of course. Let's dive a little bit deeper into diagnosis. I know you chatted a little bit about it, but once someone has been diagnosed with low vision, what does therapy and treatment actually look like?
So we'll sit down with patients and we'll determine what their needs are to determine what exactly are their difficulties. It could be, it not always is reading. It could be just mobility. It could be just dealing with day-to-day tasks. It could be with glare and light sensitivity. It could be with, there could be visual field changes. So somebody, not just vision, but they could lose peripheral vision, and mobility in that sense could be an issue. So in that case, treatment is based on a patient's needs and what it is that they're trying to achieve.
And so when it comes to low vision therapy and treatment, what are some of the most effective tools that you are seeing that are available today?
Well, certainly magnification always is helpful, and many cases, unless some patients don't find benefit from magnification because of other reasons. Some patients have very, very poor contrast sensitivity, and they will need other tools like visual enhancing aids, contrast enhancing aids like um, video magnifiers. They can also want to just go to the theater, and they would need sort of telescopes, glare filters. These are the traditional methods, but now with artificial intelligence, we're actually getting other tools like you know tools that can actually a telescope that actually can allow you to look at an object and with the assistance of artificial intelligence tell you what it is, or even have a person that's actually sitting somewhere else in the world that actually can look through that person's eyes through this little device and allow them to know what they're looking at.
Right, of course. And how does the technology like smartphones, AI help people with low vision navigate the world?
Yeah, certainly. I mean, smartphones have been a great tool. A lot of patients now can do a lot with their smartphone, including using it for magnification, and it can read to you and send you your auditory messages. So smartphones and AI have been a great advancement for patients who are visually impaired. It just has made my job easier because I don't have to always have them resort on difficult devices that they find sometimes difficult to use. So you have at the same time, smartphones have their limitations. So there's sometimes dedicated devices that almost act like smartphones that can be more specific, for their needs.
I think one of the biggest questions is in terms of like we know that there's therapy that exists to support this, but I'd like to go back a little bit and just really talk about the daily life and like how people are adapting to having low vision. And so, can you let me know what are some of the common challenges that people with low vision would face in their daily lives?
Certainly. I mean, we talked about reading, but it can also be as simple as recognizing faces. People sometimes are feel that people think they're ignoring them because they can't recognize them. So a lot of times, even just recognizing faces, navigating unfamiliar places, these are some of the challenges, and just performing tasks on a day-to-day basis, like just you know preparing their meals, seeing the numbers on the stove dial, microwave, things like that. These are challenges that a lot of patients can face, but they can be helped to minimize those challenges through low vision rehabilitation.
Absolutely. And it's so great that this solution exists because I can imagine that there's a lot of emotional and distress that comes with facing low vision. In your opinion, what kind of challenges do you think actually come with having low vision?
Well, certainly emotional, challenges. A lot of patients are afraid to tell their friends or loved ones that they're having these difficulties. So at the same time, support from family and friends is very important because these challenges are necessary. You need the help of others to kind of help you overcome some of these difficulties. And so working with professionals, could be health professionals, even mental health professionals sometimes, to
Yeah.
listen to somebody's difficulties and maybe help them overcome some of these challenges and frustrations.
Absolutely. I think when dealing with anything like this, it's so good to lean into the resources that are available from medical professionals like yourself, but also that support of your family and friends and your community around you, because yeah, low vision is definitely something that would be challenging to navigate. Our eyes are such a important sense, right?
Yep.
I'd love to dive in more to the future of low vision. You being, an expert in this area, are there any exciting advancements that are happening right now in low vision treatment or really assistive technology that you're excited about?
Yeah, I mean, I think AI is going to make a huge, huge change for a lot of us in terms of what we can do in terms of helping, and also for patients to have a lot more choice in terms of navigating the world with visual impairment. I mean, and even then, what used to take, I tell patients, what used to take 20 years to in terms of treatments, what used to take 20 years is taking 20 weeks with AI allowing it to assist certain testing of new products, or even surgical treatments, or even implanting of technology in the eye, or even stem cells. So the future is definitely bright in terms of looking for possible cures, but even assisted devices are going to be greatly improved over the next number of years with AI.
That's awesome. I love hearing that. And I'm sure there's a lot of people that are watching this that can relate and maybe have family members or loved ones experiencing that. So I appreciate the insight into the hopefulness around low vision. What is one thing that you wish people understood more about living with low vision?
Um, I think that people with low vision can still lead a fulfilling life, and that they don't necessarily, a lot of people work with low vision, and I recently had a patient that told me that she's been working for a company for 20, 30 years, and nobody knew that she had a visual impairment because she was afraid to tell them. And I don't think it has to be that way, because if you do your job and you have maybe the right tools to allow you to do it, there should be no need to hide that fact from people. So I think people need to understand that just because somebody has a reduced vision doesn't necessarily mean that they can't do something as well or even better than somebody who has normal vision. I think raising awareness is key. We just need people to be more aware that people with vision who have visual impairment don't have a unfortunately or fortunately don't have a visible disability. Sometimes I've had patients asked, well, you wear glasses, why can't you see? And that's unfortunate. So people sometimes don't understand it. It's more of an understanding of what it really means, and that's what we try to do.
Absolutely. And that really ties into the marketing side of things as well. Like it's about that educational piece of letting people understand what low vision is. That's why we're doing this webinar today. But also just like as practices, really ensuring that that message is out there so that people have those resources for who they can go to. And so I guess my next question is, if someone is experiencing vision loss, or someone maybe that's watching this knows someone who's experiencing vision loss, what is the first step that you would recommend they take to get help?
Well, I mean, if they haven't seen an eye care professional, that would be the first step, making sure that it's, some people just assume, oh, it's just a normal sign of aging, or I'm just, struggling because of whatever reason. And a lot of times, or many times, it could be a reason that could be a little bit more serious, that could be treatable if you catch it early enough. So preventative care, I can't stress that enough. But if somebody is experiencing some changes, they should see their eye care professional, even if it's only been a certain, under a certain amount of time, because who knows if something isn't uh, that couldn't be addressed, or, sooner rather than later. And then, of course, if that professional feels that that person could use some further assistance, referring to a low vision professional specialist would be the next step in terms of rehabilitation.
Absolutely. Getting in touch with healthcare providers about this stuff is so important. And like you said, preventative as well.
Correct.
Those were all my questions today. Thank you so much for joining for this webinar. If anyone has any questions, I'll put my contact information up on the screen to get in touch with us. As mentioned, we do marketing for eye care professionals like Dr. Papadakis, helping them really educate the market on these different medical specialties like low vision. Thank you so much, Dr. Papadakis, for joining us today. We really appreciate your time and your expertise.
Thank you so very much, Kate. Appreciate your 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 questions, and if I can help anybody with any other questions, they can reach out to me too.
Awesome. Take care, everyone.